Good morning, everyone. My name is Gary Ashley. I'm Executive Vice President with Allied National. I'd like to just thank everyone for taking a little time out of their busy day to join us for this webinar. I'm extremely excited about today's topic, and it looks like everyone out there is, because this may be a record number of attendees. We had several hundred people registered. We're well into the hundreds now for people who have signed in here. We greatly appreciate you coming in here. Quick housekeeping note, everyone who's online is muted right now. You cannot speak. Obviously, we don't want 100 people jumping on audio all of a sudden. And we will do a Q&A at the end of the presentation, but we'll do that interactively through the control panel for GoToWebinar here. So if you'll notice on your panel that you're signed in on, you should see a question box. You can type in questions. Feel free to type those in anytime during the presentation. When we get to the end of that, we'll go through all those, try and get them all answered. If we don't know the answers, we'll definitely figure it out and get back to you. We actually record this webinar and do a transcription of the questions and send you the Q&A afterwards, so you've got it all in writing. Again, I'm very excited about today's topic here. Allied has been one of the leaders that we think in the nation in terms of doing reference-based pricing, our Freedom plans for the group level funded market here. We've been very aggressive with it over the years. It's been the majority of our sales. Now we're coming up with Freedom Hybrid to help people have what we're calling it the best of both worlds, which is the acceptance of PPOs and the pricing advantages of RBP. We think it's a great concept. We know we're not necessarily the first to do it, but we're jumping in hard and aggressively into this, and we think everybody will be really excited with what we have to offer here. So with me today is Sales Manager Randy Wayner. Randy is going to lead the presentation today. I'm going to hang around and help with any Q&A in case it's needed. So for right now, let's turn it over to Randy and let's get started. Thank you.
All right, thank you so much, Gary. I appreciate that. And I think really a great key with what Gary just had said is that we are a company that always listens to our agents, and we have heard the feedback from agents. Having a hybrid concept would be a great idea, and as we've been an early emerger with reference-based pricing, I think you'll find that we've got a real simplistic product here that you can really market to your clients in a terrific way. So right away, we look at what is the Freedom Hybrid Plan. Well, this is a new Freedom Hybrid Plan utilizing, in the simplest way for us to describe, a physicians-only PPO network and also reference-based pricing. So you can still see any doctor or provider, for that matter, that you want to see. You don't have any type of out-of-network penalties with this whatsoever. And that's a real key, because many of your PPO plans will have, obviously, an out-of-network penalty. But here with the hybrid plan, there's no out-of-network penalties for using non-network physicians. I almost want to just repeat that again. Again, no out-of-network penalties for using non-network physicians. Plus, the simplicity of the plan is that facilities and non-network physicians use reference-based pricing. So Allied is essentially introducing a physician-only PPO network. So why and what makes this so important to us? Well, let's dive into it a little bit further here. So first of all, it's why we call this the best of both worlds. First, it's the ease of access and acceptance with network physicians, really eliminating any possible friction points for the doctor's charges, such as what you might have with office visits, urgent care sites, or providers where you've got doctor's charges included there. Overall, significantly cheaper than full PPO plans. Just yesterday, I was interacting with an agent who was comparing a network plan and a renewal, and already wanted to look at this with the Freedom Hybrid Plan. The savings were really significantly lower than the PPO plan. And to be able to go back as a selling point and tell the client, you no longer have to worry about out-of-network penalties, because this product eliminates that feature as well. So substantial savings altogether. So let's reiterate just a little bit why we're offering the Freedom Hybrid Plan. Allied wants to eliminate the friction point with physician acceptance. So that's a bold statement, and that's really comforting, I think, for you as an agent to market this to your clients with that. Plus, offering the freedom of reference-based pricing while still catering to those really who have a need or the comfort of a PPO. You know, Gary had indicated in his opening piece that Allied has got extensive experience, really over 15 years of experience with reference-based pricing, probably one of the early emergers with reference-based pricing. So we know how this concept works, and it's not something we just created haphazardly. It's a lot of thought and a lot of work has gone in over the years to make reference-based pricing what it is today with our Freedom plans. So we believe that a hybrid product can be another unique group health plan that agents can market with substantial savings to their employer. So let's dive in a little bit to the nuts and bolts of this, if I can use that just for a moment, of how this Freedom plan does work. First of all, members receive an ID card with the name of the physician-only PPO network. If we were looking at questions already here, and Gary's going to look at some of these here in a little bit, probably already someone stating, is the name of the physician-only network going to be on the ID card? Yes, it is. And there are two PPO networks for provider physician-only network, and they are PHCS and they are the Prime Health Network. So those are the two choices that you have. So keep in mind, no out-of-network penalties. I want to keep repeating that. So non-network physicians and all health facilities are reimbursed using reference-based pricing. Plus, Allied already has marketing materials on our website to help you market this. There's a flyer that's available, materials that you can use, and to also help your client understand the simplicity, again, of the Freedom Hybrid Plan. So members can go to any physician. And if that's one of the key points today that you remember, I think that's a great thing to keep in mind, that members can go to any physician. No out-of-network penalties. And that's what I really like about this feature, that even if your physician is a non-network, members still have the choice to see who they want to see, as non-network providers are reimbursed utilizing, and although we use the abbreviation there for RBP, reference-based pricing is what that's all about. So some of you have already texted a question about HSA. So we're going to actually answer that question as we're coming into it here, because we do have this plan available with HSA options. So employers can sponsor plans that are compatible with the HSA tax rules. So you can market the Freedom Hybrid Plan as an HSA plan, just as you do on our traditional Freedom plan and also our Freedom PPO plan as well. So we're going to give you a kind of a quick shameless plug here for a moment here of our plans overall that we're offering, and a little bit on the scale of price savings. I think is a really great helpful tool here to have. So keep in mind that out of all of our really group major medical plans, our most economical plan here is the Freedom Essentials plan. And it's still a full major medical plan, and it's our best economical plan available. Then followed by our Freedom Traditional plan is next with that. And so that uses 100% of our reference-based pricing. So the Freedom Traditional does not have the hybrid concept of the physician-only network with it, so it just utilizes reference-based pricing. And of course, as you can see at the bottom of your screen, we still offer a full PPO network plans, such as with Cigna, or really a plethora of other local networks are available. So let's do, just real briefly, a quick reminder again about reference-based pricing with the Freedom plans here. Basically, you remember that with reference-based pricing, no preferred providers or networks are required. I think that's really a key driver here. Members receive the value of PPO-like discounts for medical services. The plan reimburses providers by using Medicare plus accepted payment levels. So a lot of times you'll ask, well, what is the percentage of payout that we're going to pay out? Well, it's easy, and it's here on your screen right here. Allied reference-based pricing plans pay physicians at 125% of Medicare allowable reimbursement, and facilities, here's the other piece to it, and by the way, this is on the ID card as well, at 150% of Medicare allowable. We really find that to be what we refer to as fair and reasonable to providers here. So that's the whole key for us. We want to keep in mind here just for a moment some of the what we call tips that makes level funding plans really do work. So we're going to tap in here to a little bit about our funding advantage plan. What makes level funded work so well? Well, first of all, it's always helpful to be reminded of the overall employee and dependent health. So what do you as an agent know about the group? What does the employer know about the group as far as the health? It's always good to have an understanding of what are the health issues going on in the group, if you can gather that information as well. What's maybe the healthcare consumption patterns? Do you have a lot of people using emergency room care? Are they utilizing heavy brand name drugs for RX consumption? What are the healthcare consumption patterns of the group? Those are a couple of key quick questions that are always helpful when you're looking at a group and considering level funded plans overall. And then good plan designs, which can lower consumption. You as an agent can make recommendations for designs that are going to really help lower the healthcare consumption, identifying that. And of course, being on a level funded plan, the employer as well as yourself will have access to monthly reports and quarterly utilization reports, so you'll be able to look at the consumption and make determinations even for the coming renewal, what's going to be the right plan design for the group to have. And then long-term financial stability and commitment, we really want to help the employer understand that this is a plan that the employer is committing to for a 12-month plan. It's not the type of plan where you kind of hop on for a few months and then after a few months say, well, I'll go back or change something as you might do in a fully insured world. But with level funding, the employer does need to be willing to make a commitment to stay on the plan for the full 12 months. The plan year really is quite critical. And so let's kind of jump in a little bit here, with the cost for the plan as far as how we divide that up in our level funded format here. So first of all, funding advantage plans costs are divided into three categories. So really simply, the first piece that you see here is the claims fund. Now, this is determined by reviewing medical enrollment forms for the groups, for groups of under 20 lives. So it used to be that groups over 20 lives had the same process, but for those that are 20 lives or greater, we have a new 20-plus enrollment process where we have a detailed census that we ask you as the agent to complete. And with that census, we're going to, for those groups that have 20 plus enrolled, we're going to look at online history of prescriptions and hospitalization. And from that, we're going to give you a firm rate. If the group likes the rate for the 20 plus enrollment underwriting, then each employee will complete a short 5-question yes or no, kind of a simplified medical underwriting questionnaire. And as long as they answer no to the questions, the group can have the plan and they can complete an employer statement form and we go forward from there. So the claims fund is determined through medical underwriting, either for groups under 20 lives or over 20 lives. And then on top of that, the next category is stop loss insurance. So remember that a level funded plan means that the employer's risk is capped. So the employer really, all they have to really be concerned about is making their monthly payment. They've got two types of stop loss protection that are provided with this plan, that come with the plan. The first one is the specific stop loss. This is for specific medical claims, such as a treatment or a surgery, maybe a gallbladder surgery or a hernia surgery, just as a quick example there. The claims fund would absorb the first part of the claim to a certain specific amount, and then above that amount, the specific stop loss pays the claim at 100%. Then there's also aggregate stop loss insurance. This is where, again, if all the dollars in the claims fund were to be utilized before the 12-month plan year is up, then the aggregate stop loss steps in and pays all the claims for covered expenses and covered claims at 100%. It's really that simple. Then even there's another feature called aggregate accommodation, which means that any time that there's insufficient funds in the claims fund after the employer makes their monthly payment, then the stop loss carrier automatically and seamlessly pays the difference of the amount that needs to be made to make the claims payments and pays the claim at 100%. So again, all the employer needs to be concerned about is just making their monthly payment. Then the third piece is the administrative and sales cost. Now this is the cost where Allied's cost, where we're going to administrate the plan. We're going to pay the claims. We're going to pay you compensation. We're going to generate the monthly and quarterly reports, provide client service assistance to your members as well. So that's the third piece of what makes up the cost and how they're divided with the Funding Advantage plan. So I'm going to shift gears for just a moment. A feature that we're going to talk about here next, which really grows with a lot of popularity and offers instant savings, is our Health Choices plan. And this is a feature that you can offer today with these plans that can offer an instant 6.5% discount. So the Health Choices, it's really a benefit option that provides the Funding Advantage members with an immediate discount if they use certain services. Now, this benefits them greatly and provides really enhanced care as well. So it really is a wonderful feature to where it offers what we refer to as a free second opinion. So for many health needs, including such as diabetes care, maybe mental health, even substance abuse, even for that matter, maybe you need an image scan or upcoming treatments or surgeries or even a Tier 4 specialty drug, then you would be able to make a call into our nurse team at the Health Choices phone number that's provided to you, and we would offer to you a free second opinion just to allow you to hear what might be another option that could help improve this health treatment that you're about to have. And with that, we'll reward you. Where maybe for a diabetic condition, if you take advantage of our suggestion, we can waive some of the costs for testing supplies. For a mental health issue, we can waive the office visit copay for a lot of that, or a lot of the out-of-pocket cost if you're about to have a surgery, where you take advantage of our recommendation of maybe another facility that might have a better reputation with performing that same type of surgery, not only at a better outcome, but also for lower cost as well. So it's really a great feature, and we want to talk about that here as we have to give you another feature benefit that you can offer to your client, even when looking at the what we call the Freedom Hybrid plan as well, because it can be added to that plan as it can be added to the Freedom Traditional plan. It does come included with our Freedom Essentials plan as well. So let's shift again back to the underwriting, as we kind of talked a little bit about the underwriting overall. This would include for our Freedom Hybrid plan as well. Again, for 2 to 19 employees, it follows our standard individual health question forms that we have as well. And then I already talked about the 20 plus enrollees, where you would submit a census for final rates, and then we have the 5 simple yes or no questions that you'd answer with no to, and then from that the group would be able to have the plan based on the census information you provided. And then on top of that, participation, which is something we've not spoken about. So the Freedom Hybrid plan, as well as our full major medical plans we've just talked about, do follow our standard participation rules for 75% of the full-time eligible employees, minus any valid waivers. In other words, waivers where members already have existing coverage, full major medical coverage. So we would need either 75% minus any valid waivers, or we can not consider the waivers and just simply ask for 50% of all of the full-time employees to join the plan. So it's just as simple as that, either the 75% minus valid waivers, or at a minimum just 50% of all the full-time employees as well would be the participation rule. So to close, when does our new hybrid plan start? So I'm sure that's a question that's already, in fact, I do see it here on the corner of your screen. So we have launched this effective May 1st. It's already been available for quoting just in the last few weeks here, as I was mentioned in an earlier slide here, that I already had an agent that was quoting it for renewal coming up and saw substantial savings compared to the PPO plan. So effective date's May 1st. And it is available on our WinAllied software, so you can jump right into it with the software on your own. Or, of course, our sales team here can also help you with that too, and generating the quotes for you as well. So that's available through WinAllied at this point. So we're going to take some time to look at some questions, but I did first want to say a hearty thank you for taking the time to join us here today. We realize your time is valuable, and we are just really so excited to have the opportunity to present a Freedom Hybrid plan option that allows really the opportunity to eliminate friction point when you're members at the doctor, and having a physician-only network available, but still having the complete freedom to choose any provider you like to choose for that matter. So the first question that comes out of the gate here right away is obviously a good one here, and I know Gary's probably going to chime in here for a moment as well, but what is the compensation on this product? So it does follow our typical rule for all of our group major medical plans, and that's 8% of the total monthly payment. So once in a while you have some small miscellaneous fees that wouldn't get comp on, but overall it works out to be right at 8% of the total monthly payment is what the compensation is. So, and then another question that I had yesterday that I thought was real good to see, again, are the PPO networks available to see the doctors in the network? And that is absolutely correct. When you go on the website at alliednational.com, right away you'll see under tabs at the top, you can go under the member tab and it'll say find a provider, and there you'll see the listing of PPO plans that we have. On the right hand column you'll see the PHCS or the Prime Health network as well that you can choose from. I helped an agent review the physicians with PHCS yesterday on the example I had, and we were quite amazed at the amount of physicians that were available, very close proximity in the area where we were looking at as well there too. So that's a good thing with that too. Then a third question is, Gary, maybe you've got one here you want to answer as well. Go ahead, Gary.
Well, I was just going to jump in and talk a little bit more about the networks, because I'm looking at the list of questions that everyone is typing in, and they're still coming, and some excellent questions. So there's two networks available, obviously the PHCS and the Prime network. You can only select one network for a group, and there is a pricing difference between those networks, and it's priced on an area by area basis. So depending upon the zip code of the group, there'll be anywhere from a 1% to maybe a 4 or 5% difference between the two PPO networks. Now, when we quote for you internally, we'll automatically quote for you the cheapest available network option. But if the other network is more suitable in your area, then we can go to that network as well. And again, there's only a small price differential there. So someone asked, what's the robustness of the networks in the area? These are two extremely large PPO networks. I know everyone's very familiar with the PHCS network. They've been around for a long time, and they have the markets pretty well covered, but there may be markets where one network differs over the other. We really can't judge that, because what really drives a person's selection of a PPO network is my doctor on that panel. So go online, follow the directions for finding a PPO provider inside these networks. And I wanted to say one other thing, because we've had a question about it. In the PHCS network, it also includes what's called their ancillary network, which provides us in some markets some ancillary providers, like an urgent care center, maybe an imaging center, places like that. So there are some select facilities included in that PHCS network that may be good in a particular area here. And again, that's something that you'll just have to judge based upon your knowledge of your own marketplace. Randy, you want to take the next ones?
I'm not able to see them where I'm at here. That's why I was asking you to go ahead if you want to take the next one.
Let me go through the list here. So early question that came up, and it's an excellent question, something we probably should have covered, is if you use a non-network doctor, is balance billing covered? Well, the balance billing protection has been our mantra around here from day one with the RBP on our Funding Advantage program, and that still is true. If you're any facility, any non-network doctor where we're doing RBP, the balance billing protections still exist. Obviously, if you're using a PPO doctor, they've got a contracted rate that they will accept. If it's a non-network, though, we'll go through the standard RBP pricing. And in some cases, with an RBP doctor, we may actually get better pricing for the member through our RBP discounts and save them a little bit of money. So the PPO versus RBP is kind of a trade-off. It costs a few points more to use the PPO network for the physicians, but the trade-off there is ease of acceptance for primary care doctor acceptance, for instance. You know, the number one complaint people have about reference-based pricing is who takes it. Well, everybody takes it in some way, shape, or form, but the question is who will accept it unquestioningly, and that's where this comes in. The majority of encounters people have with the healthcare system are with their physician's offices, and going to the hybrid network eliminates that friction point with RBP while still maintaining some of the great discounts we have available to us for the large cost items and facilities and things like that. So it really is the best of both worlds here. Let me
another question, Gary, that Sandy was able to bring back up for me. Where will 50% participation make collecting waivers unnecessary? We always like to think that getting a waiver form completed is always in the best interest of the employer group. It's always good to always have a waiver and explanation as to what type of coverage they have. But technically, if you choose the 50% option, then that's all we're requiring is we at least need 50% of the full-time employees to sign up for the plan. So if you follow the 75% rule, then we're going to have to utilize the waiver forms for that. But the 50% we would need just the full-time total employees of the group, 50% of them sign up. So hope that answers your question. I think it's a valid question as well. Gary, I'm going to elaborate again. Yesterday, I was working with an agent who had a PPO network, and after he looked at the difference in the rates, said, "Why would I not want this physician-only network?" I said, "This is a tremendous savings, and it just really makes sense to look at the idea of having a physician-only network because the group was really set on that. This really bridges that issue really nicely in offering a physician-only network." So that was a tremendous plug, I thought, for motivation, even though it was a renewal consideration, but for even new groups that would like to have this option. It's really tremendous. Okay, you already answered the question about the balanced billing. Let's see here. Anything else here that we can do here?
We've had kind of a couple of general questions about reference-based pricing and even one about premium-only plan. Someone's asked, are the majority of our businesses signing up using a POP plan so that they can get the tax benefits? We find that the majority have already set themselves up for that, done the necessary paperwork. But a reminder to everybody, that should be something you should be talking to every client you have and make sure they're setting this up properly so that everyone can take advantage of the tax deductions of the employee premium payments. If your client isn't set up for that, that's something we will do free of charge for our group health plans, provide them the paperwork to make it all legal and above board so that they can do the proper tax deductions for that. It's well worth it. A question from Darren up in Idaho. Stats on balance bills we're seeing in a percentage and turnaround time. This is something we've really worked hard on in the past year with our outside providers, with the legal teams that get involved in some of the bigger disputes. We find on balance bills that it's less than 2% ever turn into a true dispute. We routinely get providers, facilities in particular, coming back to us and just asking for a review and why did we pay that, and they haven't even gotten the member involved on that. So the majority are satisfied without anyone even knowing there was any kind of coordination between us and the provider on the payment. Less than 2% go into a balance bill where a member gets involved on that, and we jump in on those. Our goal is we set both a dollar threshold where we won't even argue it, and then we try and set like a 30-day turnaround time. Now, sometimes they'll take longer if we can't get the member to actually help in the process. That's part of it. They need to They need to let us know what's going on. They need to engage us in the process so that we can help them out. It goes very quick once the member is aware that, hey, we're doing this for you to save you some money, and we're getting much more aggressive with us directly contacting the member and trying to hold their hand through the process here. And like I said, our goal is really to keep these 30 days or less so that there's never any kind of panic over, do I owe money or not? Haven't always been successful on that in the past. We've had a health system in one state that has insisted on grouping disparate bills from multiple groups and multiple members together and trying to pool negotiate to bring extra leverage on against the plan. So always a lot of interesting situations when you deal with RBP, but our number one goal is to make it painless to the members and solve these as fast as we can, and we're continually working on updating those processes.
Gary, there's a question about the POP plan again with the pre-tax POP documents. You can actually, someone's asking how to access that. On our website, you can do a search under POP documents, and you can have a web page where there's an actual form that the employer would complete, like an application per se, and filling that information in. Allied will then take that and create the documents necessary to have on file by the employer. Of course, we do not administrate that piece of it, but we will provide the legal documents, and there's no additional cost to having Allied create those documents as long as you have a group health plan in place with Allied. So that's a feature that we offer at no additional cost. So that was a question that came up as well.
Got another kind of related question here on filing of claims and providers who kind of struggle with the whole RBP concept here. The number one thing we have tried to do is to personally contact, with the members' help, their physician or facility who may be struggling with RBP. 99 times out of 100, the provider is just worried that it's not a legitimate health plan. When we let them know that this is an ACA compliant, employer sponsored major medical health plan, and we use those exact terms because they seem to work, 99 times out of 100, the provider says, oh, okay, that's fine. And we do a typical explanation of benefits with them, let them know deductible's been satisfied, or maybe there's some deductible left. Right on the ID card, we talk about how payment is made. We talk about how to file a claim. It's all there for them, and the providers are actually getting pretty well educated. In very limited areas of the country, there are certain small rural health systems where they're the only game in town that say, oh no, we won't play with RBP. Well, we do the best we can to educate them. If not, we will shift to some sort of PPO methodology, hopefully to get it resolved, or we will even negotiate in advance on a potential payment for the group. So there's all sorts of ways we can deal with these, but the main thing is communication and us being able to work with both the member and their provider to get things resolved. Those are relatively few, and they're getting fewer because I think providers are getting used to RBP in many markets. We're obviously not the only company doing this, and more large employers who are in the pure self-funding market are doing this to control their costs. So the providers are getting used to it, and the biggest employers in their markets are pushing them there. So we're seeing some definite sea changes in how people look at reference-based pricing out there in the marketplace. Randy, anything else you wanted to ask? The questions keep going here, but we don't want to keep everybody all morning.
Right.
We'll respond to all of these questions in writing in the next day or two and send these out to everybody so that we can make sure everybody's got the same answers to every question.
I think that's it, Gary, on this side. I want to thank you for chiming in here with answers to the questions as well, and just to reiterate that we will put out an email with a full recorded copy of the webinar that you've enjoyed listening to, as well as a separate document that will have the questions that were all asked and the answers as well. So Gary, I think we're ready to close this up. Are you okay with that?
I am okay with that. I just want to say one last thing. I want to thank everybody for coming. If you're looking for a quote, reach out to your local general agent, most of whom are online right now listening to this. If you have our software, it's available on that for you now. Or you can send us a quote request if you don't have a GA in your area, or we can send you to a GA if that's what you prefer. But thank you for your time today. We look forward to just a busy, what's normally the off season here coming into the summer. Activity is way up here, and I think this is a great opportunity for everyone to get into our freedom plans here. So thank you for attending, and have a great rest of your day.
Thank you.